If you want to see what entry-level jobs look like to get in the medical field, stay tuned. I'm going to give you a list of them.
Keep on walking straight.
Hi, welcome back to my channel. This is Nurse Laconda, and I'm coming to you today to give you some entry-level positions that you can do if you plan on getting in the medical field and you just want to get your feet wet. You want to see how it is to work in a hospital, and you just want to know how it feels before you even go into the nursing field or into any medical field. See if this is even what you really want to do, if you want to work in the hospital at all. So I'm going to go over a few positions that even as a nurse that I deal with and worked with as a nurse when I worked in the hospital on an everyday basis. And the first position is, they might call these positions different things depending on where you work, but I'm just gonna say what I called them when I worked in the hospital, and that was dietary aides / nutrition aides. These are people that work in the hospital, and they come around to the rooms and they first find out what the patient's likes and dislikes are, and they ask them questions about the meal. Did they like their meal? You know, was it hot enough? You know, things like that. And then they even help if the patient is not happy about the food service, or they haven't been getting good food or hot food. They even help with those issues. So the dietary aide comes around, and then I know during meal pass, a group of them come to the floors. They bring a hot cart up and they distribute the trays to the rooms. Typically deliver the food to them, make sure they're happy with their meals, and they also come back and pick the trays up too. That was what the role was at the hospital that I worked. It might be a different role at the hospital that you work, but it's all in a similar way. And also they also prepare the food downstairs in the kitchen for the patients in the hospital. Same as nursing home, they usually work in the kitchen. They bring the food, they bring the trays up. They either distribute the trays, or the CNA on the floor distribute the trays in the hospital. So the dietary aide is somebody who nurses deal with all the time, because you got to make sure your patients is getting the right food, and if it's any issues, you can call them. They'll bring up a new tray and things like that. So that is another entry-level position that you could get in to see if you even want to work in the hospital, because you will have communication with different entities in the hospital, different disciplines in the hospital. Another position in a hospital that you might want to get into or look into for an entry-level job before you even decide to get, going to the medical field is a medical secretary or a receptionist. Those are typically the people that greet you when you come to the hospital to see your doctor or go for a test. They are usually the people that sit at the desk who you talk to, and you can give them your identification information. They sign you in, and then you go sit in the lobby and wait for them to call you back to the back and things like that. Another position, and I did this when I was before I became a nurse. I did phlebotomy, and what I did was, the hospital that I worked at for a very long time, they taught the CNAs phlebotomy, and I'm gonna go into the other thing as well, but they taught us phlebotomy, and we also was able to get like a certification or a certificate in it. So I was able to use that phlebotomy certificate that I got from one hospital. I was able to use that certificate at other hospitals in Illinois through agencies. I would sign up for agencies and tell them I'm a CNA, I also do phlebotomy, I also do this, and I would go to another hospital and only do phlebotomy, and they would pay me. And back then, that was in the 90s, I would get paid like $18 an hour to work at a hospital for a 12-hour shift for 2 days in a row through an agency, and make $18 an hour just doing phlebotomy. They would actually give me a pager, and anytime they needed a blood draw, they would text that pager and it'd say the room. And then when I get the page, I'll go to the nursing station, get the label or whatever, or the requisition, and then I'll go in the room, introduce myself to the patient, and tell them I'm going to draw their blood, and then we'll take it down to the lab. That was a nice job I did. I actually liked that. I was a CNA at the hospital that I worked, but I only worked part-time there, and I did that for as a supplement 2 extra days of the week. And I know they have like at the, you know, like at junior colleges or community colleges, they might have like a quick program you could take if you just want to do phlebotomy to get your feet wet, to get in the hospital and understand. Because believe me, if you're going to school to be a nurse, you need to know how to draw blood, because it's going to be those times that you can't get anybody to come. They might be busy and you need to draw the person's blood yourself. Or you might need to get an IV in them. And all those techniques are basically the same, looking for the vein. And also, people do these for a career, you know. I'm just saying, I'm just quoting it as, if you want to get your feet wet in the hospital, you could do these things to get in and work in the hospital to see if that's the field you want. But actually, people do this stuff for a career as a living. So also, the next thing I did too was EKG technician. They also, that hospital I worked for, they taught us how to do phlebotomy, and they also taught us how to do EKGs. EKGs is when you put those stickers on the chest area, around the heart, the arms, the legs, and it read the heart to see. Most of the time the doctor is looking for if you had a myocardial infarction, other name heart attack. So that's what the EKGs are usually done for. And as a CNA, they taught us how to do EKGs because they were getting a lot out of us at one time. So I took that certificate, and like I said, I signed up for other places and worked and just did phlebotomy and EKGs through agencies and made more money with the certificate that I got from that hospital. And those are easy, those are easy jobs. You just go in a room, take somebody's blood and leave. I mean, you can't ask for more than that. And then you go in there and put some stickers on their chest and then press a button and print out the EKG. Those are easy jobs to get your feet wet to see if you even want to work in the hospital. Another thing I did as CNA. Okay, so CNA is Certified Nursing Assistant. I worked many places as a CNA, nursing homes, hospital. The main place I worked as a CNA was a hospital. And when you go to a hospital, they give you additional training where they call you other things like personal assistants, and they call you different names. So depending on what hospital you work at and what facility you work at, your name will be. But the basis was a CNA, and then they teach you more. They taught us how to insert Foley catheters, like I said, EKGs, phlebotomy. I don't know if CNAs is still doing those things, but I did it when I was a CNA. And as a CNA, you could work in multiple settings. You know, you could work in a hospital, you could work in a clinic, you could work in schools, clinics, schools, nursing homes, hospital, and it's probably more places. If you know more places CNAs could work, please put it in the comment section. But yeah, you could work different places, and you could be making money while you deciding on what you want to do, or just to make money, period. I did CNA for years before I became a nurse, and like I said, I did other things too. I did the phlebotomy, the EKG. I worked for an agency. The good thing about a CNA, you could sign up for different agencies and they'll pay you more money, and you could just go to local places in your area, different hospitals or nursing homes. I remember at the time I didn't have a working vehicle, so I used to have to get on the L. They call it the L in Chicago. I used to get on the L train and go to different jobs as a CNA for 2 days a week. And I still worked at the hospital, but I would pick up other shifts because they pay more money if you go through the agency. With the phlebotomy, I forgot to mention too, with the phlebotomy, you could sign up for laboratories and different places. Like it's people that work for different labs and things like that. They go out to the nursing homes and draw the people in the nursing home blood, and then you can do multiple things with a phlebotomy certificate as well. You can make money. You just got to do your research and figure out where you could go and what you could do with it. Home health aid. Home health aides are, if I'm not mistaken, yeah, those are the people that work at for like the elderly, or for people that's young, that might be like paralyzed and things like that. They have like something called a personal assistant. And then you have people that work for Department on Aging. They have like a homemaker through these homemaker agencies. That job is in high demand. As a case manager, I deal with those things a lot. I know those jobs are in high demand because people, it was a big turnover rate during COVID. So those jobs are in need for people. Elderly people need people to come in their home and help them with activities of daily living. Alrighty, so the train here came, so I had to stop recording. because it was loud. But I think we left off on the sterilization technician. I'm not sure, but yeah, those are I heard those jobs pay pretty well, and it gets your feet wet in the hospital, see if this is the place you want to be. Because I think once you work in the hospital, you either love it or you hate it. And usually sometimes people move around in the hospital, especially in the entry-level positions, to see, you know, just get a feel of everything before they especially if they start young. They just move around. I know people that done moved around the whole hospital, worked in all different type of little areas. But the next thing is custodial worker, or they call it environmental services at a lot of places. But wherever you at, it might be a different name, but it's the same thing. Those are people that clean the rooms. Now, the people that clean the rooms, they are very, very important, because I was a manager at a nursing home of a rehab unit, and I had a girl that worked on my unit as a custodial person or environmental service person, and she was phenomenal how she cleaned the rooms, and you didn't realize how good she was till somebody else came and cleaned the room, and you just saw stuff everywhere. So I would go in the room and inspect the room before a new admission came, and I would see stuff on the rails that didn't get clean, or I would see things on the floor like spots or something on the bedside table, and I have to call them back like, excuse me, I know you said you cleaned the room, but this room needs to be re-cleaned. I wouldn't want any of my patients to come in this room with it looking like this. But when she would take off or be on vacation or be off, you know, she had off days, they would send somebody else, and they, you know, that's how you realize the good from the bad. Okay, sometimes we take good people for granted. And so when she come back to work, baby, what you want, a coffee? Bring her some. You know, I used to bring, when I was a nurse manager, I used to bring my staff stuff, and I would include them too. Like, it's not just for the nurses. I would, you know, not just for my nurses, CNAs. I would include the people that work, the other entities that worked on my unit too. I would bring them coffee, donuts, whatever I was bringing, I'm bringing for everybody. If when I order pizza, they got pizza too. Those are very important roles in hospital, nursing home, wherever. If people clean their rooms, because first of all, the hospital is not that clean of a place because you got so many germs everywhere. So you really have to clean it well to get, you know, it's a person that was in here with all types of pathogens and germs, isolation in a room prior. You got to get that room clean for the next person so they don't be introduced to anything that the last person left. So those are very important jobs. I know in the hospital they really did a good job. I never really had any issues with the people in the hospital in the bag, and then take it down there and just let them wash that by itself. So that was the good thing about the nursing home laundry area. You can get stuff done right away. The hospital had loads and loads and loads of stuff on board, so you never had to worry about stuff like that in the hospital. But those are good departments to work in to get your feet in the door. Laboratory technician, that is different from the phlebotomist. The laboratory technician, from what I know of at the hospital that I work, they work down in the lab. When you send those labs downstairs after they've been drawn to the lab, they run the tests. They run the tests and upload the results in the computers. Those what those people did. That's a good job to have. I don't think you need a lot of education for that. I think that's like an entry-level position. Also, another thing was that a lot of men, it was women too, but a lot of men got these jobs in central supply or the stock department in the hospital. They would unload the boxes for the supplies. You know, the hospital have all types of supplies, urinals, bedpans, IV bags, IV tubing. I mean, just think of all the stuff they use in the hospital. That all goes to a central area called central supply, or it might be called something else in your hospital or in different hospitals. But those are the places where all the supplies get shipped to and get unstocked, and then those people that work in that area, they are assigned to go to different floors and stock up those floors with the supplies that everybody has to use, the nurses, the CNAs, the respiratory, and everybody else use. The other thing that that's really not in the hospital, but it's more at clinics, is medical assistant. A medical assistant, I think, is like a step above, or it's a little bit above a CNA, because I think they get more schooling, but they usually work in clinics and they do a little bit more than CNAs. They input different things. And usually a medical assistant is the people that you see when you come on your appointment and you go in your room and you waiting on the doctor. They usually come in, take your vital signs, and get a little bit of history and put it in the in the computer, so the doctor have everything before the doctor gets in. You do have to have some schooling for that. I don't think it's long. I think it's a little longer than CNA program. Now, some CNA, let me go back to the CNA program. When I became a CNA, way before I became a nurse, I took a program at a school in Chicago that was like a trade school. It was a school that you could go to just to learn a trade, so you could get done and get out and start working. And I hate they closed that school down, because, you know, it's like the stuff that people need, they closed down. And people would go to that school, and I don't know if the funding got messed up or whatever, but they will get, you know, little certifications or whatever, and they'll be able to get a job. That's the school I went to, and it was a 3-month program. It was in the evening. It wasn't like it was like an evening program, so if you had a job, you could actually leave work and go to the program. It was from like 4 to 9 or 5 to 9. I can't really remember, but I did that class to become a CNA. Now and it was a 3-month, you know, because you had your book work, and then you had we had clinical too in CNA. We used to go to the nursing homes too, and that's how I became a CNA. But it only took me 3 months or 3 to 4 months. I know it was probably 3 to 4 months. I can't really remember, but it took a couple of months. And I think medical assistants take a little bit longer to do. But the good thing is you could just go to a clinic and you'll probably get a job. Or you could go, if you really need stable work and you're not ready to become a nurse yet, you could take that little class and be able to work to provide for yourself while you're figuring out what you want to do. Or you could just do it as a job. It's up to you. So yeah. Some classes though are much shorter. You know, they always have these rapid programs, because I know I heard of a CNA program that was like 2 or 3 weeks, and I'm like, oh my god, how could you fit this stuff in? But I guess if you're doing it full time every single day, you could cram it all together. I don't know, but I heard that certain programs are much shorter than what I took, but I can't speak upon them because I'm not aware. It's just what I heard through the grapevine. Also, another job too, besides in the hospital, is a Medicare driver. Like, those the people that pick up the people from their house and take them to their appointments. That's in high demand too, because, you know, people have to get out. A lot of seniors, they don't drive, and, you know, they need a ride to their doctor's appointments. They need a ride to their dental appointments. They need a ride to different places. And then you know, that's in high demand. So I'm just giving information out that if you need to work, you need a job, and you need a job, you know, soon, and, you know, you don't have time to take up a class, or or you don't have time to take up a long class, and you just want to get out there in the medical field really quick, these are certain positions that you can get. You have to do a little research and figure out, you know, what school you want to go to, what class you want to do, or, you know, and then do it and go ahead and get your feet wet and see if the hospital or the medical field is even something you want to do. It might not even be anything you want to do after you work there, but then it might say, yes, I want to do this, and I want to do more, and I want to get my feet wet in other areas too. So these are entry-level positions that you don't need much schooling that you can do. So thank you for tuning in. But first, please like this channel, or this video. I'm sorry, I always say like this channel. I mean, like this video and subscribe to my channel. I'm going to keep on making content, letting you all know about the healthcare field, nursing, doing my nursing edition, and just stay tuned for more.
Keep on